Hello everyone, I am Dr. Rania Siddiq, Clinical Instructor in Pediatric Nursing Department, Faculty of Nursing, Cairo University. Today we discuss the procedure of formula feeding. Now let's start the procedure with clinical guidelines.
Formula feeding. Clinical guidelines. Formula feeding is used to provide adequate nutritional intake and maintain weight gain. Formula feeding is indicated when infants have contraindication to breastfeeding, such as galactosemia, maternal use of illegal drugs, and untreated active tuberculosis. Formula milk or expressed breast milk can be given by bottle, cup, spoon, syringe, or dropper. Principles of formula feeding. Number 1. Feeds should be freshly made up. Number 2. If you have to store made up formula, concentrated or ready-made formula, nurses should consider the following. If made up formula is stored in the fridge, use within 24 hours. If made up formula is stored in a cool bag with an ice pack, use within 4 hours. If made up formula is stored at room temperature, use within 2 hours. Number 3. Explain the procedure to the parents. Involve the parents when present. Number 4. Explain to the mother that she should do sensory stimulation to the baby by touch and eye contact during feeding. Number 5. The remaining powder should be tightly covered and stored in a cool dry place and should be used after first opening within a month. Number 6. Always use glass bottles, marked plastic bottles, or plastic bottles labeled free bisphenol A, BPA. BPA is a chemical substance which used to manufacture some kind of plastic. BPA can be harmful to your baby. Number 7. Prior to feeding, ensure that the infant's nose is clear of secretions, the diaper is clean and dry, medication and weight are checked. The available bottle formulas. Number 1. A ready-to-use forms in can or bottle which need only be lightly shaken before use. Number 2. A concentrated liquid form that is diluted with an equal amount of water 1:1 dilution. Number 3. A powder form that must be prepared according to the manufacturer's directions, such as Similac. Feeding schedules. Ideally, feeding schedules should be determined by the infant's hunger. Number A. Infant's feeding when he or she shows signs redness is called demand feeding. However much use scheduled feeding, arrange it at predetermined interval to meet family routines, usually every 2 or 4 hours. Bottle cleaning. All the utensils used in feeding need to be thoroughly washed with the bottle brush in warm soapy water. Rinse with running water from tap, then sterilize to protect against infections. Methods of sterilization. Steam sterilizing, electric sterilizer, or microwave. Number 2. Sterilizing by boiling. Boil feeding equipment in a large pan of water for at least 25 minutes, making sure it all stays under the surface. Number 3. Cold water sterilizing solution. Leave feeding equipment in the sterilizing solution for at least 30 minutes. Thank you.
Now we will mention the equipment for formula preparation and feeding using a bottle. Number A. Bottle with suitable nipple, as it's shown in figure 2. I need this bottle with suitable nipple to your baby. Measuring cup for mixing powder formula. Measuring cup for mixing powder formula. Plastic spoon stirring formula. Scoop for leveling powder formula. Bottle brush needed to clean thoroughly inside the bottle. Pipes or wash clothes. Equipment of mouse care, distilled water and gauze. Disposable apron, appropriate formula, either stored breast milk or powder concentrated liquid or ready to feed formula. Now we will start the technique for formula feeding preparation using bottle. Steps. Firstly, as any procedure, we must do hand washing to reduce transmission of microorganisms. Prepare all needed equipment to save time and effort. Wash hand again to reduce transmission of microorganisms. Wear gown and gloves. Read the feeding instruction, type of milk, amount, and concentration in the baby sheet. Review instruction for preparation that listed on the label as specific for each type of formula milk. I must read the instruction in the milk bottle with the steps of preparation, because the manufacturer instruction may differ from company to another company. Bring the sterile bottle and don't contaminate it. Add the milk powder. Put the required amount of distilled water in the bottle and check it on a straight surface. For example, say Dr. wrote order in the baby sheet to give 30 milliliter filter milk every 2 hours or 3 hours. So I prepare the distilled water, open the bottle, and then I will pour the amount as doctor prescribed. Add the milk powder, cover the bottle and shake the milk well. Now I need to level in the powder level. Label the prepared formula appropriately with label, infant name, type of formula, amount of formula, concentration, and time. And I will put it on the cover of bottle to prevent any errors. After preparation, remove the equipment and let the area clean. To prevent possible Pseudomonas contamination of skin, decontaminate hands thoroughly and remove gown and gloves. And finally, wash hand to reduce transmission of microorganisms. Now we will start bottle feeding procedure after we did the bottle preparation or bottle formula preparation. Steps. Number 1, wash hand to reduce transmission of microorganisms. Prepare all needed equipment to promote efficient time management and provide an organized approach to the procedure. And then wash hand and follow the hospital policy, such as wear a disposable apron to reduce transmission of microorganisms. Number 4, check label on the bottle or formula. Child name, type of formula, amount of formula, concentration and time. And check the nipple opening, that it should have a steady drip but not a steady stream of fluid. To prevent aspirations, check the amount of formula in the bottle on a straight surface. To prevent any error, test the temperature of milk by secreting a small amount in the inner aspect of the wrist. To check temperature, it should be warm, not hot. Warm feeding or cold feeding if needed, by place the bottle in a container of warm water or cold water. Place a pipe or watch close around the infant's neck. This will protect his or her clothing. Hold the infant in the upright position. We have 2 techniques of handling during feeding. Number A, place the infant into the crook of the arm, as it's shown in figure 6. Number B, ensure the infant is well supported for feeding with head above his or her stomach, like in incubator that is shown in figure 7. Because this reduces the risk of accidental aspiration of stomach content. An infant should never be bottle fed while lying flat. Now, I will apply the 2 techniques for handling the baby. The first, I will handle the baby like an incubator in the same side or position by handling the baby in semi-sitting position like this and support the back, head, neck, shoulder and back. The second technique, I need to do mommy restraint in blanket because I will transfer the baby from shown in number 9 is place the infant into the crook of the arm in upright position. Stimulate rotting reflex by rubbing nipple along lower lip or tickling side of cheek. Place nipple on the top of feeding and don't contaminate the nipple. to encourage infant to open mouth and position nipple appropriately. Tilt the bottle to keep the nipple full of milk at all time. This prevents the infant from sucking in too much air, which can cause pain, discomfort, and vomiting. Then, burp the infant halfway at the end of feeding by 2 techniques. Number 8, place a small towel over your shoulder to protect your gown. Place the baby firmly against your shoulder and pat the back by cupped hand. Number B, the second technique for burping. Place the baby in sitting position. Put a towel beneath the chin, support the chest and head. With one hand, gently rub the back with the other hand, like this. And figure 8 and figure 9, it's showing the same technique we said. Feed the infant over 15 to 20 minutes to prevent overfeeding and vomiting by hurrying or forcing the infant to feed too much. And after finish, remove the empty bottle by sliding the little finger between baby gums and nibble to release sucking if the infant doesn't want to let it. Place baby on right side. To promote digestion and to prevent aspiration of vomiting. Must do provide mouth care with gauze at the little finger. And distill water and squeeze. Then discard the gauze. And remove apron to prevent cross infection. Record the amount of formula, type, child reactions, and report for any abnormalities such as vomiting. Appropriate clinical records are essential to provide documentation. After we place baby on right side,